Hello, I am Abigail Shaver, and I did my research project on the hepatitis B virus, which is also the scientific name of the virus. It's not fancy or anything. Okay, and we'll start off with the viral structure. Now, this is an enveloped virus, and it belongs to the hepatinovirus family, and it is a double-stranded DNA virus. The double-stranded genome is encased by an icosahedral protein capsid, and this virus, it reproduces kind of like retroviruses, but remember, this is not an RNA virus. This is a DNA virus. And it reproduces through a reverse transcription of an RNA intermediate. And once this virus does become mature in your body, it will start attaching itself to your hepatocytes, which are your liver cells. Now, this virus can cause chronic infections of the hepatocytes, and it's through the way that it spreads. They continually shed the virus into the bloodstream of the host, so it has immediate access to all of your liver cells, and that is what can cause a chronic infestation because of how your immune system would attack this virus. And when you get the chronic infection, it's all going through your bloodstream. Now, your hepatocytes are actually a longer lived cell within your body. They are your liver cells, but they can live up to 6 to 12 months or longer. So that gives the virus plenty of time to make its way all through your bloodstream and attack your liver cells. And many hosts live with this virus long term. And it depends when you caught the virus, of course, because the younger you are and the more immunocompromised you are, it's easier for these cells to make their way through your immune system. Because your immune system sees this virus, it's also attached to your liver cells so your immune system doesn't even realize that when it attacks this virus, it is also attacking your hepatocytes, which entails for liver damage. Now, transmission is a little different. Now, you need to be infected either through a bodily fluid such as blood or semen, which is why this is a sexually transmitted virus, or if you use drug needles and shave with a razor that has been used by an infected person, which is why if you have this virus and you go home, you need to be careful and cautious about where you leave things that are infected with any bodily fluids of yours. Now, hepatitis A and C, they are spread more through food and water. This virus, you need bodily fluids. And if you do suspect that you have come in contact with anything that may have come in contact with hepatitis B, you need to contact your healthcare provider immediately and get treatment. Now, this virus is also it's a concern for any expecting mothers, especially if they know that they are infected with the hepatitis B. It can travel through body fluids and it can cross the placenta, although most infections happen at birth when the placenta breaks because the baby is being shoved through the vaginal canal. It comes in contact with blood and vaginal secretions. Usually that's where the babies end up getting it. Now, humans are the primary carriers of this virus. Animals such as rodents, woodchucks, primates, they can get a hepatitis B, but it's not the same strain. So you can't really spread it to them and they can't spread it to us, and they don't catch the same type of hepatitis B. Now, hepatitis B, the main issue that healthcare providers worry so much about is because it is asymptomatic. 90% of the time is you usually don't even know you have it. And if you do get symptoms, sometimes it can present itself as just a regular little sickness that you just get over. And it is estimated that 6 and 10% of people are unknowing carriers. So anyone who is unvaccinated is at a higher risk of hepatitis B. And people, like I said, any drug addicts who are using needles or come in contact with bodily fluids and injecting yourself with a needle that could possibly be infected, and reusing your own needles is very dangerous because it just opens you up to getting infections. And if you are sexually active, you should be tested more frequently, especially with several partners because, like I said, it's asymptomatic. You don't really know that you have it, and you could be unknowingly spreading it. And of course, pregnant women should always get tested for the sake of themselves and their child because it does cross the placenta. And of course, the child who has been born from the mother who was previously infected by hepatitis B. Now, hepatitis B outside of the body. Humans are the reservoir for hepatitis B, but it can live outside of the body for up to 7 days. And it can remain infectious during this time. So even a dry drop of blood can still carry the infective form of hepatitis B. And then that's what I said. If you're at home living with your family and you are infected and you know you're infected, it is important that you throw away shaving razors and toothbrushes and just don't leave that stuff lying about where your bodily fluids have touched it and your child or wife or whoever could possibly come in contact with it. Now, your signs and symptoms, like I said, this is more of an asymptomatic virus. You might not even show any signs until up to 3 months after you've been infected, and by that time, it can make its way through your blood. But like I said, if it's more for the immunocompromised, like children and older people, I mean, it can become chronic that way. And then like even if you've only had the virus for a short time, you won't get the presenting symptoms. It can be 6 to 8 weeks, 3 months, never. You need to get tested if you even think there is a slight possibility you've come in contact with this virus. Now, like I said, this virus, it attacks your liver. So if you do get the symptoms, it's going to present itself as liver disease. Now, your liver, it filters out toxins in your body. So when it is unable or damaged, you will feel the effects of those toxins starting to run through your body. And this virus, the way it damages the liver, it can be scar tissue that you see, or cancer is number one for what it causes because it is damaging your hepatocytes so rapidly. Now, your physical symptoms, like I said, it's going to be presenting itself as a liver disease. So you might lose your appetite and you'll have clay colored bowel movements, nausea, vomiting, fatigue, and fever. If you had those symptoms, like I said, you wouldn't really go straight to having hepatitis B. So it is important that you get tested. You might have joint pain, jaundice, which is just the yellow coloring of within your skin or eyes. And is the virus here to stay? Well, many adults and older children are really not at a high risk because even if they do contract it, their immune system is more adept to handling it. Now, younger children and immunocompromised, they are more at risk to develop the chronic hepatitis B because not only do they have a longer time to deal with this virus, their immune system, it just doesn't know how to correctly fight it. And even chronic hepatitis B can be asymptomatic. So, like I said, getting tested is number one. And as soon as possible if you think you've come in contact. And currently there really is no cure for the virus because it's attached to your hepatocytes. You can't just take out all of your liver cells. So it's more here to stay if you get the chronic version. Now, if you have suspected hepatitis B, you need to run to your doctor and he will run the blood test. Like I said, it runs through the blood in order to infect all your hepatocytes. So a blood test will be able to test for the virus's presence. And when they do test your blood, they can test for the amount of the virus that is in your bloodstream, which would make you more likely to spread the virus. Like if you didn't have a heavy load of the virus in your bloodstream yet, it'd be less likely for you to be spreading it all around. Like if you had a dry drop of blood somewhere, there may be a smaller chance that it has the hepatocyte virus in it. So if they see a higher load of the virus within your bloodstream, they'll say that you are more adept to spread the virus. And they'll also do ultrasounds on your liver. Like I said, this is damaging your hepatocytes. So when they do ultrasounds, they can look for cancer or liver damage, such as scar tissue. And they can do a biopsy, which is highly recommended because of the high chance that you could get cancer with this virus. Now, treatment. Like I said, it's asymptomatic. Sometimes you don't really need treatment. You don't have any symptoms. You're walking around fine, but it is very, very necessary for you to keep getting liver screenings and making sure your liver is still functioning properly because hepatitis B is not really the main sickness. It is something that's going to get into your bloodstream and cause other sicknesses, liver failure, cancer, anything other than the virus really isn't going to be the main cause of symptoms. It's going to be just causing your other body systems to go AWOL because it is taking down your liver. Now, acute hepatitis B, like I said, if an adult were to contract it and they have a very good immune system that knows what it's attacking, it's just kind of like a common flu. You get rest, good nutrition, plenty of fluids, just kind of treating it like a little stomach bug. And there is no cure or specific drug that will kill this virus. So, honestly, it depends on which type of hepatitis B you've contracted. If you get the chronic, you're going to be living with this lifelong and you may remain asymptomatic, but there is no cure to get it out of your blood or stop it from tearing away your liver. And like I said, vaccination is the key to prevent the virus. So if you are vaccinated, you don't really have to worry about this virus anymore. And you can get HBIG, which is the hepatitis B immunoglobulin. This is a shot that you can get that has blood in it from a person who has immunity to this virus. It's kind of like they did with the coronavirus. You get a shot from someone who is, immune to this virus, and it puts it in your bloods in order for them to fight off the virus that's in your body. But you have to do this quickly within 24 hours so that you don't get a heavy load of virus infestation. Now, like I said, your liver is what you're worried about when you're treating this virus. Go to a liver specialist or someone who really understands hepatitis B so that they can watch and maintain your liver so that it doesn't get into a critical state. And you should also get screenings for cancer because it is damaging your hepatitis or hepatocytes. And any other thing that you can do to help your liver out is great. So avoid alcohol, stay physically active, and eat healthy. Don't put any unnecessary loads on your liver because it is already dealing with another virus. All right, so epidemiology, like I said, your younger people are at much greater risk of getting chronic hepatitis B. They don't have as good of an immune system as an older man or woman. They need the extra help. And it's estimated that 9 out of 10 infants who become infected with chronic hepatitis B. So it is very important for pregnant mothers to be aware and know whether they are infected or not so that they can get their child the help that they need before it becomes too late. Now, children above 6 and adults, they almost always fully recover from this virus. So it is not really something that someone with a healthy immune system who is older and has a body that's able to fight off this virus needs to worry about. Now, this virus will occur in every part of the world. It's made its rounds, it's spread, but it is most common in countries that don't have direct access to health care. So, I mean, South America, Asia, and Africa, they don't have the healthcare systems that America does or other higher countries. So you do see more infections down there because they don't have direct access to these vaccines. Now, your mortality rate, it's been reducing each year. It's, people, now that we have the vaccine and people are more aware getting it, you don't have to worry about so much of a mortality rate. And the 2025 goal is currently set as 0.37 deaths per 100,000. And in 2018, they did reach the goal that was previously set at 0.43 per 100,000. So this virus, it's going down with more awareness and reaching out to countries that can get them the vaccine. So your morbidity rate, it is estimated that currently 257 million people are living with hepatitis B worldwide. In the US in the year of 2018, 3,322 new acute cases were reported, and these are the acute cases. They aren't the chronic cases of hepatitis B. So, I mean, If the people that were infected had a better immune system, they probably fought this virus off anyways. But like I said, this is asymptomatic virus, and a lot of people are just walking around. They don't even know they have it. So it's expected that that number is astronomically higher than it really is presented. So that is it for my presentation, and thank you for watching.